Thank you, Mr. Secretary, for being here today, and I just want to start off with thank you for all the great work we're seeing the VA do in Nebraska, and especially over this last year.
Thanks.
Last year during this hearing, we talked about needing to invest in the cemetery grant program. We did, and the Grand Island Cemetery is now on its way. And in your most recent budget, I was pleased to see that a new medical center for Omaha is now #2 on the SCIP list, so thank you for that. That medical center is nearly 75 years old, and obviously renovations aren't going to cut it anymore, so we're very excited to see that move ahead, and I look forward to working with you on that. I appreciated your comments in our conversation about the community care program, and I do remain concerned about the future of that program. We have over 40% of Nebraska veterans, they live in rural areas, and many are located hours from the nearest VA facility, so that community care program is really vital for those people. In recent months, I've heard some of my colleagues call for tightening or even scaling back on that community care program. Of course, I want the VA to work on improving the appointment wait times, but that doesn't change the reality that we face in rural areas and sparsely populated areas. So does the VA have any plans to modify the access standards for that care program, and can you commit to us today that rural veterans will maintain access to care through that community care program?
Yeah, you know, the statute is very clear, the Mission Act, that drive time standards will continue to be impactful for rural veterans. We have big parts of Nebraska, big parts of, you know, the one I keep pointing out is Vision 7, which is part of South Carolina, Alabama, Georgia, Mississippi. You know, fully 70% of veterans there are referral qualified by virtue of where they live alone. So because of drive time. So it is an important access opportunity for veterans in rural areas. It will continue to be. Some of the things we're thinking about is updating the access standards to reflect the fact that overwhelming amount of care in VA and in the private sector is offered through telehealth. So we think our access standards should reflect that. Ideally that we'd be able to get that done fairly quickly, but that would be through rulemaking and there'd be public comment.
Then we have issues with connectivity, though.
Yeah,
broadband deployment, because a lot of these sparsely populated areas in my state, that's a big issue.
Definitely, and we're not gonna give a vet a pig in a poke and say, hey, you should get, you know, knowing that they don't have internet access, tell them to go get internet access. So we have no interest in that. That's probably the biggest change we're anticipating currently. But, you know, it's been 6 years now since the law was enacted. Since then, we not only had the Mission Act, but then we had the pandemic, and now we have the PACT Act. Any one of those things would be a seismic impact on VA. 3 of them in a row. I think I'm really proud of the way our team has managed them. But I think it's reasonable for us to take a step back over the course of this year and ask, what are the impacts of all those things? If we anticipate changes out of those, we'll come talk to you about it.
Okay. You know, as we talked about on our call, you have a tight budget.
Yeah.
Very tight budget. And given the ongoing implementation of the PACT Act, which I was very proud to support, I believe it's important for the VA to ensure that it has staff in place to meet the needs of access to assist veterans. And I know in Nebraska we added over 200 employees, new employees this past year to VA facilities. But with the department's budget request, I think you're envisioning an overall reduction of approximately 10,000 healthcare workers. Can you talk about the department's plans on how it plans to reduce the workforce, and will the reductions be equally spread across the VISNs and the VA facilities?
Yeah, so thanks so much. You know, we envisioned at the end of 2025, so that's September 2025, to be at about 10,000 fewer FTE. When all is said and done, frankly, that's, if you measure traditional attrition at VA, that's not much different than traditional attrition. However, because retention is so high, because you've been so generous to us for various pay enhancements, we have historically high retention, historically low quit rates. As a result, it might be a little tougher. We are not going to make those decisions from headquarters. These are going to be decisions made by our VISN leaders. This year is going to be a year of, as we're calling it, strategic hiring, where we need people. A good example is recently in Texas, San Antonio has been looking for GI experts, one of the most limited capabilities in healthcare in the United States right now. They finally found two, but they hired them both, right? So we'll continue our strategic hiring, but those are going to be VISN-based and facility-based decisions, not me making those decisions from here as a politico or as a bureaucrat. That's not good for veterans. And we'll track this month by month. We're doing this on FTE. We're doing it on dollars spent. And we'll talk this through with your teams so that they can follow along with us and watch that. And my guess is, I think one of our great strengths is our facility leadership having the kind of relationship that Omaha does with you, with their delegations. And so my guess is this is going to be a very public, very well-debated effort, and that's the way it should be.
Good. Good to hear.
Yeah.
Thank you, sir.
Thank you.